start the recording here, guys. Of course, we can like edit out anything, but we record these each time we do them. It's goes up on our YouTube, and then we send out some notes on everything as well. So I'm gonna be starting all of that, and we're slowly gonna have people trickling in as we go. But yeah, I would love to meet all of the people here so far. Like I said, Holly and Nino, if you both are there, would love to meet you. Hey.
Sorry, it's really just me. It's my husband and I's account. But yeah, I'm Holly Mazurko. I am a veterinarian for a municipal shelter. But a colleague of mine are thinking about branching out and doing a mobile unit in our area to provide care for areas that need it, that we see in the shelter. So yeah, that's what we're thinking about. So thought this was a good lecture to listen to.
How exciting. Do you know Jordan?
No.
Oh, look at that. So, well, welcome. Glad you guys are meeting. I think this could be very helpful for you. Jacob, nice to meet you, Jacob. How are you?
I'm good.
Yeah, would you
I know
like
Jordan a little bit.
what is it?
I said I know Jordan a little bit.
Oh, cool. Well, I'm glad you're here. I hope you're excited for the conversation.
Oh yeah, definitely.
Are you based out of Texas as well?
I work with Spay Network. I was being sarcastic. Yeah, I'm the marketing and communications director at Spay Network.
Oh my God, amazing. Well, hi, it's very nice to meet you.
Nice to meet you.
Thank you for joining. And right next to you is Shahir, who works on the marketing team at our company, Solaritas, and he helped organize this. So hi, Shahir.
So my name is Shahir. I'm looking after all the marketing efforts of Solaritas Digital. Thanks for joining this webinar.
Thank you for putting it on. I really appreciate you helping organize this. Serena, welcome. Nice to meet you. Hi, my audio camera's not set up. My name is Serena, clinic manager at Inland Valley Humane Society in California, joining on behalf of Dr. Karen Lee. Thank you so much for joining. It's very nice to meet you. And finally, we have Laura. Laura, it's very nice to meet you. How are you? There you are. Hi.
There, sorry about that.
Good.
Hi, it's nice to meet everybody. I'm the executive director of Animal Welfare Association in Voorhees, New Jersey. We run a affordable care clinic and mobile veterinary clinic as well.
That's so cool. Do you happen to know Mark Massaro?
No.
He's a fellow New Jersey guy. I'm New Jersey born and raised. So, but I'm right across the bridge in Philadelphia.
Oh, well, you are 20 minutes from us.
Wow. Well, hi, neighbor. Thanks.
There you go.
Good to see you. Well, with that, I think we've all kind of become acquainted. We have one more person to introduce properly, and it's our special guest of the hour, Ms. Jordan Craig, who is a executive director for Spay and Neuter Network. She's got extensive experience in animal welfare, with experience in wildlife rehabilitation as well, domestic animal sheltering and managing shelter operations, whether it's at Austin Animal Services or Dallas Animal Services. She has a track record of creating innovative strategies to help improve animal welfare and has spoken at national conferences on using data and automation to enhance her processes. Most recently at an Orlando conference, which she's coming back from. So I'm very pleased that she made time in her schedule to come join us today and talk a little bit about the work that she's doing to help increase access to low-cost care and how to continue improving access. And this is an open conversation, so if throughout any of you have any thoughts or questions, feel free to shout them out or to type into the chat. We really want this to be kind of an open conversation, but towards the end there will also be a chance for questions too. So without further ado, I'd love to introduce Miss Jordan Craig.
Thank you so much. I really appreciate you all having me, and thank you all for taking your lunch hour, or depending on where you are, earlier in the morning with us. As Daniel said, I am Jordan Craig. I'm with Spay Neuter Network, and we are a nonprofit located in the Dallas-Fort Worth area as well as San Antonio. And we are all about trying to end pet homelessness and make sure that pets and people can really stay together. He gave me a very good introduction. There's not much more to add, but I do have, if you want to reach out to me on LinkedIn or via email, my information is right there. And it really is, I started in this field because I loved animals, but very quickly, I remember working at the Little Wildlife Center, and I was told by the executive director at that location, when she made me move into the center manager job instead of working with the animals on the day-to-day basis, she said, "You're a people person." She says, "You're always going to impact more animals by leading people than you are by actually touching the animals." She's like, "I know you want to go play with the raccoons right now." She says, "But you're going to save so many more lives by working with the people." And I fought her a little bit, but she was right. And that has kind of driven my endeavors from my early 20s until where I am today. Spay Neuter Network, we are celebrating our 20th year of operations this year, which is very, very exciting. And we have touched so many lives during that time. It all started when our founder moved outside of Dallas into this community called Kaufman, Texas. And it's southeast. It's about 30 minutes outside of Dallas. And in the first year that she lived on that property, she ended up with 30 new pets, because they kept getting dumped there. They kept wandering through there. She could never find where they went. And she kept asking her neighbors, like, "What is going on? What do you do?" And they just said, "This is the way it was. This is life. Puppies get dumped out here. Animals end up in the country. And that's just, we deal with it. We find them homes or we keep them." And none of them were getting vaccinations. None of them were getting spay neuter. And immediately her brain went to, "Oh my gosh, we've got to build a shelter." But she's someone that does a lot of homework, and she did her research and found out very quickly that you do not want to start by just building a shelter, because it would be full, just like her home was full, within a short period of time. So she started a high quality, high volume spay neuter clinic. It started as a mobile twice a week, and they would do about 2,000 pets the first couple of years. And then they built their first brick and mortar in Crandall, Texas, which was very exciting. And from there, really kind of operated as Crandall is the hub. Crandall is in Kaufman County, so again, just outside of Dallas. But we're using the mobile and the transport that I'll talk a little bit about later to reach further, but really started to expand about a decade into the inception. So in 2017, with the help of some funding and related to the Surge project, opened a clinic in Southeast Dallas in the Pleasant Grove neighborhood, which is historically a neighborhood of high need for animals. And then Fort Worth next door said, "Hey, what about us? We want to have a clinic too." So in 2019, with the help of the Saving Hope Foundation, we opened a clinic in Fort Worth to serve their residents as well. We also, in 2020, started partnering with the city of Dallas to take all of their surrender phone calls and requests. So to make sure that people that are looking for the safety net of the shelter had a resource aside from just bringing the animals in. And we started that. The plan was to start late in 2020, but we all know what happened that year. And April 2020, we started it about 6 months early because the shelter desperately needed help in talking to people and scheduling appointments, because everything was scheduled at that point. We are always looking for ways that we can continue to help. And at our Fort Worth location, we found that we were turning a lot of animals away for surgery because they weren't coming to us in condition where surgery was safe. We had a lot of really bad skin issues, skin infections, URIs, different things, and it had a higher exam and refusal rate than any of our other locations. And we were talking to the vets and we were talking to the community. We're like, "How is this happening?" And they're like, "Well, the population that's coming to us just aren't healthy enough for surgery." So we decided we were going to open up expanded care. And our mission is really focused on spay and neuter, but all of it is important to making sure that the pet and the person stay healthy and together, and that bond continues. And for us, if they can't even get surgery because they're not healthy enough, we need to get further upstream and help them. So we started a program where we provide, and I'll talk a little bit about later, but we provide antibiotics, basic vet care. We can help if there's skin issues, eye issues, URI issues. There's so many things that we can do in that community. And the most of the people that are taking advantage of that service live in the zip code where the clinic is. So it really is in the neighborhood. Ray mentioned InReach earlier. We are a part of that community, and they know to turn to us for help. We also, in 2023, endeavored to expand outside of the DFW Metroplex because the city of San Antonio reached out and really needed help. They have an amazing amount of funding coming through the city to support spay neuter services, but they did not have enough providers to utilize the funding that the city had. And so we are in a city-funded building providing services to the community and the residents of San Antonio as of 2023, and it's been absolutely fantastic. Sorry, I've got some work going on at the house and the dogs are excited. So our strategic plan and our strategic pillars involve access to care, really making sure we are removing every single barrier possible so that people can get what they need for their pets, and making sure that we have things affordable, making sure they can get to us. I'll talk about some of those barriers a little bit later, but looking at where can we partner, how can we increase access to these services for the residents in our community or outside. We also wanted to focus on long-term sustainability. We've been around for 20 years. We continued to grow, but we really wanted to make sure that we had a foundation that could continue this. I think the pandemic was pretty eye-opening for a lot of us, as well as the veterinary shortage that's going on, of how can we make sure that we are impactful and sustainable in the long run? Because if we're not here to help people, who is there to help them? So that's really a focus. We want to invest in our people and in our organization to make sure we're here for the long haul. Brand expansion. And Jacob is on the call. He is my marketing and communications director. And you know, we have done a pretty amazing job in the recent years of brand expansion, so much so that our call volume to our customer service agents has gone up 33% this year, and which is fantastic. There's that many more people needing our help, but getting the word out there, because again, if people don't know where to find us, we had a 6.5-year project in Dallas to reduce costs, spay and neuter. And yet when I go to events and I knock on doors, not everyone knows who we are, where we are, and where they can get help. So how do we have members in the community and that in-reach to make sure they know where they can go so that they don't feel stuck? We also are all about training and collaboration. We cannot do this work alone, and we have got to build up our skill set, the skill set of those around us, and make sure that we are all working together, because this is a big task. Trying to end pet overpopulation and the unnecessary euthanasia in the shelter, this is not an easy task, and we can't all do it alone. So really focusing on where we're really good at something, partnering with other agencies to make sure that we're all working smarter and not harder. And then also getting stakeholder engagement. We have been around for 20 years, but we currently do not have a very robust volunteer program. We are trying to grow that, because that is such a way that we can get our word out and really help more people. We can also do so much more when we have volunteers on site. When we do the collaborative events where we do both vaccines as well as food, as well as support with behavior, and we have an army of 80 volunteers, we can touch hundreds more than we can touch at a general offsite vaccine clinic. And if there are any questions during this, feel free to chime in, everybody. So barriers to care. It's always interesting to me when you look at the different studies and why people are not getting vet care. A lot of these things I have listed are included. When you actually look at the studies as why people are not getting care, the number one reason I don't have it on there is just because people don't think they need it. Their pet never got hurt, their pet never got sick, never needed a vet. They may be going to the Tractor Supply store, taking care of a lot of the basic vaccines themselves, but nothing ever came up. So there's this whole other huge group of people that are not getting care right now that just don't think they need it. And they've been very, very, very fortunate that they've never had the puppy go in the backyard and get parvo, right? And I think all of us that will live and breathe in this space, it's hard for us to believe that that exists, but that is the biggest group of people not getting care right now. So getting the word out, spreading information, letting them know where services are available, where they're free, where they're near in their neighborhood will help kind of reduce that. It's also really the availability of providers. There are some communities where it's very, very hard to find a vet that's available for an appointment, especially if you have something more going on with your pet. It's more and more common to get referred out, and it's just really hard to just find a veterinarian. It's also hard for all of us that are running these clinics to find vets that want to come in and do these days. It is getting harder and harder to find vets specialized in high quality and high volume spay and neuter. Most vets, when they're graduating, which, you know, classes are graduating between 60 and 125 a year, they're walking out of vet school with really only having done 1 or 2 surgeries sometimes, unless they have decided they're going to specialize on an externship with spay and neuter, but that is a very small minority. So we have these vets that are already a shortage, and we have even smaller amount that are able to do the high volume spay and neuter. Prohibitive costs. Everything costs more these days. Costs were prohibitive 5 years ago, and they are so much worse now. So making sure that things are actually affordable for people is critical to making sure that you reduce that barrier. Proximity and location. Most vet clinics are not in the parts of the town that they need to be. Most are, when you leave vet school and you're trying to stand up a vet clinic, most tell them to look at affluence, to look for where there are going to be people able to afford to keep their doors open. So it's not really looking at where are the most pets and where are those families that the pets are ending up in the shelter and homeless. Times an hour of operation. And this is a challenge. We're dealing with a veterinary shortage. You're dealing with staffing issues. But most people work during basic business hours. So when you have restrictive hours for people to get the care that they need, it is very hard. And we're endlessly trying to juggle that, especially with surgery. It is very hard because it's a long, all-day procedure. But when people have to go to work, how can you make that time barrier a little bit lower? Transportation. Lots of people don't have a car, or if they have a car, maybe they only have one, and somebody else is using that to get the kids to school or take the kids to, or, you know, to go to work. So having transportation, there are some public transportation that lets people take the animals on there, but it is not frequent, and they get a lot of pushback. So transportation can be a problem. Physical ability to get the pet to the clinic is also, we have this come up quite a bit. People will let us know, oh, I didn't come, I had a car, but the dog that has never left the backyard, I couldn't get it into the car. And not everybody thinks about that before they know they have to get the appointment done. The animal's amazing with them, right? They're great, but they've never done this big, scary thing. And it's very, very, very frightening. And so how do we make sure that we are there to support people in these moments? I know our outreach coordinator a couple weeks ago, a woman called him and was struggling, and he went over there, he grabbed her and the pet and took them to the clinic because he's like, no, you're going. He's like, you live like 2 minutes from the clinic. I can get you. This is fine. But that's a reality. And it's not a judgment. Like there's a lot of, it's a new thing that pets go places with us, right? Like most people's pets stay home, and it's scary to go places. And yes, I see, right, yeah. Or they don't have a crate. They don't have a trap. They can't get the pet contained. They don't have a leash. We get a lot of creative leashes, and I do make sure to talk to the team. Hey, the guy here, no judgment. Let's provide him with something new. But like whatever they used worked. And also, this is huge. A lot of people do not go to the vet or seek care because they're embarrassed. They're embarrassed and they're afraid that they're going to be judged for not having a procedure done yet. They're embarrassed for not having up-to-date vaccines, not having kept the pet on prevention. So every interaction we have with a customer, with a pet owner, is so critical to building trust, because you may only have that one moment, and if you shame them, embarrass them, any of that piece, they may never seek vet care again. when most people think of Dallas, especially, you probably think of the TV show, you probably think of affluence, you imagine this wealthy commerce community, but Dallas is actually not what you would think it is. And we do not have enough veterinarians to support the number of pets in our community. The veterinary accessibility score, if you guys haven't checked out that website, I can get the link for you later. It is amazing. Ray's got it. And it is absolutely crazy to see some of these communities. Tarrant County in Fort Worth does a little bit better, and it has a score in like the 70s, but Dallas has a score of 48, and San Antonio has a score of 40. Like, there is just not enough care for the number of animals and people in the community. You can also see that majority of the vet clinics are up here in the north. We kind of talk about I-30 running through Tallis as separating the haves and the have-nots. There are pockets of need elsewhere as well, but our clinic is located right over here. It doesn't even show up when we do a Google search of a veterinary care either, which is crazy. So when we locate our clinics or our mobiles, we really try to find these veterinary deserts. We try to find these historically underserved communities. And I will say, some of the vets that come and do surgeries with us will say, why are we here? I don't really want to be at this shopping center. And we said, this is the community that needs us. This is where we belong. This is our mission, what we believe in. And the community embraces us. They love us. They love that we're there. They'll stop by and chat with us and ask questions. We've been in both Dallas and Fort Worth long enough that we have a lot of camaraderie within the neighborhood. And some of the crime rate's a little bit higher. We cannot park one of the vans at the Fort Worth clinic. It had the battery stolen 3 or 4 times. We've had catalytic converters stolen, things like that. But in general, like, it is, the community welcomes us. And it is so important to be there. And we have the location in the rural Crandall, Texas, because again, the rural is majorly underserved. We have Dallas, Fort Worth, and then also in San Antonio. And last year we provided services for more than 45,000 pets, and 4.5 thousand of those came to our clinics on our transport program. So when we really try to look at how to improve access to care, we look at where are these barriers and how can we build programs to reduce those barriers. And the first two, our mobile surgical unit and our transport program, are really focused on helping people with location, transportation, and making sure that the hours are a little more flexible. So our mobile surgical unit, which is our big RV, we've had it for over a decade now. Did get in a little fender bender earlier this week, so hopefully it gets back on the road very quickly. It has the ability to do surgery at off-site locations. We can do about 15 dogs, 25 cats comfortably on that surgical unit, with actually keeping them all housed in the big bus. We park at the location, we do check-in at the location, check out, everybody is there, it's all encapsulated, and it is a fantastic program. We partner a lot with different rec centers. We go to different locations, like we regularly at the location in Dallas. It's not that far from our other clinic, but it is a neighborhood that consistently cannot reach access to care, and where animals get picked up constantly as strays. So it's a pocket of neighborhood we really need to go to. And when we're parked in that parking lot, people are knocking on that bus door all day long. And we also have the ability to go out into communities of need. For example, we recently went out to a little trailer park in Van Zant County, which is just east of the DFW Metroplex. And this community has hundreds of animals roaming free. They do not have electricity. They do not have running water. There are several mobile homes that are just literally like pulled off. It's insane. It's absolutely the Wild West. They've been talking about building a pin around the play yard so that the kids can safely play in a playground where the dogs aren't going to go in and harm them. We've been working with Animal Allies and they have been helping bring a lot of animals from that community to get spayed and neutered. They've also been taking puppies and getting them transported north so that the population doesn't continue to grow. We have already fixed more than 200 dogs in that community over the last year and a half. But there were several dogs that it had been very, very, very challenging getting in the car and taking somewhere. So we took the mobile out there. And we worked with them. We did a bigger dog day where we had recovery outside. We had a van. We had more techs there to help us with recovery, and really tried to knock out some of those dogs that were very nervous. Their owners were there with them the whole time. It was just a whole involved community day. And that's what the mobile is all about. The surgical transport system or program is, I think, pretty unique and so effective for multiple reasons. Every day, we send out 2 or 3 transport vehicles to pick up pets at different locations, whether it's the surrounding counties in the DFW Metroplex or different pocket communities of high need that lack transportation. Getting across the DFW Metroplex can take an hour in the morning. So making sure that if you live on the other side of town from us but still need help, we will go get the pet at a bus stop location and bring it to our clinic for surgery and then bring it back later in the day. This also helps. You don't have to travel across town. It's earlier and later pickups available so that you can work within the middle part of the day. Really, really amazing. It also helps because we all know the check-in line in the morning at the clinic can be kind of long. This separates your check-in into 2 locations. We have half of our people checking in maybe Waxahachie or Corsicana. We have others checking in at the clinic, so it helps everything improve customer service-wise and efficiency. Another way that we reduce barriers to care is we look at things geographically and use target zip codes to offer more discounted surgeries. We have somewhat affordable standard prices, but not everybody can afford $100 to spay and neuter their pet. So we offer a lot of free or $20 surgeries using geographical barriers because it's really easy to find out where the census, where there's underserved, where animals are coming into the shelter. So we use that to drive that information. And also by using that targeted approach, we're impacting more of the animals in that direct community and then could move on to another community. We have our Pet Support and Resource Center. We are constantly looking at ways of getting upstream and helping people ahead of time. As a part of our surrender diversion program, we have added resources, including online behavior support, and we're talking to them about how do we do that sooner? How do we make this behavior support not just available when you say, I need to surrender to the shelter? How do we make it available so that people see that when they walk in to our clinic with the puppies and are getting vaccines to get them headed in the right direction before they ever are running into the problems where they think they need to sever the bond with the pet. So really trying to find other ways we can provide resources. And in addition to now serving Dallas with the surrender diversion program, we also take all the surrender requests for the community in Fort Worth. And offsite vaccine clinics are amazing. Some of my favorite events are you go into the park and people walk all from their homes right in that community and they come to you. We have wellness hours at the clinics on a daily basis, but we do offsite vaccine events on the weekends. We do them in the evenings when people are not available during the business hours. I've seen people chat on social media. They're like, oh, are you guys still out there? I think I can grab my pet and get over there in time. Like, it just gives more people an opportunity to reach you when you think of creative ways to either be near them or different times of day. Going back to us in Fort Worth, figuring out that we needed to do more to help that community, to make them ready for surgery and just to support them in general. We have been looking at kind of it as a different umbrella of Spay Neuter Network Plus or SNN Plus, and looking at ear, eye, and skin issues. We did a survey to find out what the community wanted before we started this program. And one of the first things that they identified that we weren't quite able to do at the kickoff was dentals. We have since initiated that, and it's a growing program. We are trying to get more blood work and different things in place so we can do older dentals, because our community still trying to afford preventable dentals, it's a little bit hard. So we're trying to expand that program to this day, but the community has asked us to do it. We've also been seeing puppies currently that come in with diarrhea, vomiting, pretty sure parvo. We refer to them to the shelter, and very, very soon we're going to stop doing that. We're going to start sending take-home kits so that they can treat parvo in home, and that doesn't mean they have to lose their pet. We're also going to be providing end-of-life services for pets in the community, because it can be quite costly. Our goal is to keep that cost as low as possible, just a $40 exam, and then also directly work with crematory services so that they just pay that direct cost to them if they so choose, but they can take the remains. So we're just trying to find more ways that we can be a part of the community and support them, and we've been listening to what they need to drive that. There are a lot of technology challenges in this field. We have currently, our CRM for our general practice information is quite outdated. It was built 20 years ago, and it's been heavily modified. I'm sure a lot of you have similar situations, because it was not built for a spay neuter clinic, but they worked with us, and so it works, but it's very, very old. It's server tied, it's not in the cloud, it makes things challenging. We still use more paper than I would like, but we try to build as many programs around that to improve the processes, and we are currently in the process of updating our scheduling system. 74% of our appointments are booked online. So it is critical, and our current appointment system is better than a lot of things out there, but we know we can make it even better. Trying to find ways, again, I told you the call volume's up 33% for our customer service agents. So how can we get more of the services easily available? Because 80% of people that go to our website and use our services use their phone. So how can we make it very, very mobile friendly? How can we improve things so that they can get through the line faster in the morning? We do get some nice Google reviews that are like, oh, we got there and it actually moved really fast, even though it looks scary, which is comforting, but I know we can make it better. Because there are also people that we hear from that are no-shows because they couldn't wait in line because they had to go to work. So we're constantly looking at how can we make that process better. We are always looking for solutions. When we did the diversion program, again, all of this happened faster than we wanted it to in 2020. We had 5 or 6 systems going to do the program initially, and currently we only have 2. We worked with Dubert, who originally started as a transport and foster CRM, and now they use it. They have companion case management, and it has become one of their strongest platforms, because so many of us have different things we need to track on a case level, like food pantries, different things with diversion. There's somebody else that has a much smaller scale using it for spay and neuter. They're really tracking and making sure that they can monitor the data, because we have to know what the data is telling us, and we have to be able to report that, especially if we want to continue to serve and grow and understand where people are coming from. Our strategies for reducing costs, the biggest one is people investment. If you put the money into your team and you find equitable pay and you invest in training and in the culture and making sure they are supported, that is the biggest cost saving, because you cannot do anything without a vet. You cannot do anything without the vet tech team being there. So a lot of those costs that maybe if you're a nonprofit, the board is like, do we really need that? Or if you're a municipal, is that really worth the tax money? Investing in the team, when you have constant turnover, that is incredibly costly. So any front end you can do to support your team is incredible. 2 years ago, we started doing retention bonuses as a thank you. Every year that people stay, it's on a tiered system. So the longer they stay with us, annually they get a higher bonus. That's just one way of saying thank you. You're still here. We want to give back to you. With our veterinary technicians, we ask that in year 1, they get certified as veterinary technicians. If they want to keep going, we will keep paying for as many certifications as they want, because we know we want them to feel like they're being fulfilled, they're continually learning, and that we're continuing to build different levels so they can keep growing as people and careers. And currently our team is about 45 people. And so we're fairly lean considering we have so many different locations, but we want to make sure that those people stay with us in the long haul. I am also you have to know what's going on in your world to be efficient. You cannot daily look at different reports and tracking. Weekly, you talk about it as a team. Monthly, you look at the bigger picture. But if you're not looking at it on the regular basis, whatever that amount is for you, you can't pivot. If I'm looking at something and, you know, last week we had a kind of a slow week, and then this week it's still trending that way, something's gone wrong. What is happening? We're seeing a higher no-show rate. If we see a higher no-show rate, we'll send out a survey and say, hey, why didn't you come? What happened? What is going on? And can we make any changes to improve that? We also do overbooking related to that. So you have to understand, when you have no-shows, what is the no-show so that you can be efficient? Because it's not just about making sure that your surgery volume is full. It's every one of those pets. If an 80-pound female doesn't show up for their appointment, oh my goodness. Like, how many people with 80-pound females are waiting on our wait list just trying to get in for appointments? It's critical that we really understand the data. And we are big on process improvements. When I was at the city of Dallas, Toyota came in and paired with us and did a project for process improvement. And it was really fascinating. It related around timing different processes, identifying the different steps, seeing where the efficiencies were, and really understanding that when we were working in this high-paced, mistakes are very common unless you do have an actual process. And with the city of Dallas, the project related around administering medication in the morning. And when we started that project, we're like, we have an SOP, you know, they pull this report, they go out and do it. And we watched 3 or 4 different days of it. And we were just like, oh my gosh, everyone did it wildly differently. And that happens in our industries a lot. So where can we find ways to streamline, not to be annoying, but just to really know where the efficiencies are? Because if you don't give the specific directions and help people count from 1 to 10, they're going to create their own little pathway and some step is going to get missed. So we've done that related to check-in. We've done that related to the surgery process, really looking at where can every efficiency land. Because when you have a vet in there that can knock out 50, 60 surgeries in a day, the team has to be able to keep up. And you don't want to hold that back, especially in this day of veterinary shortages. So it's critical. And then we always are utilizing discounts, buyer programs, finding ways we can get on contracts to save money. I mean, every penny counts in this world. So we also have Amazon wish lists where I think last month we asked for things like paper. It's not super cool, but we print a lot of paper. We need that as an organization. So trying to find ways we can save. And another way, I mentioned it earlier, but another way that you can really expand your reach without increasing your own cost is to partner. If you can collaborate. When we did that project with Animal Allies out in Van Zandt County, we couldn't have done that alone. They brought another vet tech. They found the vet. We paid them, but they found the vet that was willing to work in that community. They brought extra volunteers to help watch those dogs in recovery and to work with the owners that were there that were nervous about their pets, right? We could not have done that project and been nearly as effective alone. When we do the bigger events where we do 600 vaccines and we pass out 20,000 pounds of food, we can't do that alone. It takes tons of volunteers. It takes 10 plus groups to make sure that we can reach everyone. It also, everyone has their different pocket of followers. So when you collaborate, you reach more people with what you're doing. Simply more people hear about it. And if they can come to one location, I would love to, we're constantly trying to partner with different human service groups as well. We do have a partnership with the Bridge Homeless Recovery Center, and we go out there twice a year to serve both the residents at the Bridge and their pets, but also the general community that's experiencing homelessness. But I would love to do more projects like that where we can also have human service agents there to talk to people, because The people that are struggling with getting services for their pets are also struggling with getting services for themselves. I know there's some really cool programs that are going on, I think in California, where you go and you get a vaccine and your dog gets a vaccine, right? And everybody it's just amazing. So we're looking at different partnerships like that as well. And the creativity that comes out of these is incredible. You just keep growing, and it also helps put pressure. Like, you might be really tired. You're like, oh my gosh, we have another one of those big events. But you have your friends that are like, oh, we've got another one coming up. We're going to get this done. And so you get it done together. Our training and our mentorship program, this last year, we partnered with Dr. Lavender, who was one of our founding veterinarians, and she has stepped away a bit more from her clinic. She had a private practice as well. And she was recognizing how much trouble we were having finding spay neuter vets. And so she has launched a mentorship program with us, and she will come in and work with veterinarians, not vet students, but veterinarians that they maybe can do, 5 to 10 comfortably, but want to get their skills up, want to move faster, want to be able to do the high volume. And this has also added to just available surgery days and surgery appointments in our communities. Starting next month, she has it on the schedule to do this 3 times a week, every week through the end of the year. So the desire in our field is huge, and it's just going to continue to grow. We also have the amazing Dr. Stickney, who's featured in this photo. He was a long-term professor at A&M teaching spay and neuter. He now lives in San Antonio, and that's one of the things he is passionate about. So we make sure that vet students, vet tech students go through the program, learn things from him so that he can share with them, and we can build the future workforce that can help in this pet overpopulation problem. What questions do you guys have?
You mentioned a program in California, which sounded really cool, and I'm curious. Who was it that said they were working in California? If you're still here, Serena, just something to think about in the chat. I'm curious about what other programs there are in California, like what Jordan mentioned. And I guess that goes for everyone. I think we have a pretty good representation of different geographies here. I'm curious to know if there's anyone in the audience who has any specific programs like the ones Jordan mentioned that are helping you improve access to care in general, or that got you thinking about possible ways you can. I've not seen that, but that sounds awesome. It's a great idea, says Serena. Hi, Laura.
I know I've heard Allison Cardona speak about it.
Who is it?
Allison Cardona. Ray knows her better than I do, but yeah, she could speak on it.
Oh, and thank you for being on top of the links, Ray. That helped a lot. I was checking those out as we
Love being a backup dancer, so no worries there. I don't know the exact program, but I'll definitely put Allison Cardona's information in the chat. She works for Correct Davis, which is the veterinary school, and they have, I think, over $50 million of access to care and shelter support grant available. So I'll put her information in the chat. And if you live in California, that's definitely the first place that you should stop. But as far as other programs that are available nationally, Companion Animals for Reform and Equity has a direct care program. And it's pretty much, we connect you with a trusted veterinarian in the community that you live in. And we can pay for preventative and emergency care up to $500 per patient. And in Chicago, I'll put the link in there. They have like a $1,500 program model to take care of like emergency situations. So there's a lot of programs out there nationally and locally that can support access to care. And it should be dictated by what the community's priorities are.
Yeah, that's amazing. Thank you for the info. And yeah, there's a lot that I didn't know about my own area, about as far as like access to care, and then the social vulnerability index as well, like how that was represented. I personally, where I am, I thought that like the access to care would kind of be considered would get a decent score, but it's pretty low. And I'm curious as to why. I mean, maybe it's because my county like takes up a large portion of population, and so like there's different I'm in a kind of hyper concentrated area where like there's 3 veterinary clinics alone surrounding me within direct walking distance. But as you get up further north, it's not the same. And so I guess taking all that into account is kind of what I'm seeing there. You know, yeah, because it just goes county to county, right?
Yes. And per capita, I mean, if you have a very dense community, you need more vets
That's right.
because, you know, 7 out of 10 households are on average have pets, and many of those have more than one. So when you get these more dense communities, it might seem like you have enough vets based on just a basic Google search, but not for the actual volume of pets living in your community.
That's right. Like I said, I'm in Philadelphia, and so well, Laura, actually, you've been unmuted for a while. I would love to hear from you. Sorry.
Well, and actually, it's funny because it's very much Daniel, like you're talking about. The community that our shelter's in is a very affluent community. You could trip over a vet hospital. That's not a problem, but not even 15 minutes from us is Camden, New Jersey, which Daniel will know of, which is an amazing veterinary desert. You know, low income, no access to transportation. So we do, our Vets on Wheels goes out there twice a month to do vaccines. And I do as many grant funded low cost spay neuter programs I can at our clinic. But Jordan, I think it was really interesting listening to you, and I'm going to apologize in advance for probably pestering you quite a bit in the future. Because we're part of a nonprofit, we're part of a shelter, but it's very similar, the potential for growth we have for accessible care. My struggle is veterinarians. I can get the high cost spay neuter. That I've got. I can contract that. But we offer wellness services, very much like you did. We started to offer the very, very basic wellness. You know, if you're need something advanced, we redirect you to full service. But and we do the end of life, which I could do nothing but that all day because there's such a request for it. But I'm hesitant to expand because of I've had a vet position open for almost 2 years now. I can paying a decent wage. We're not saying I'm comparable to some places. But that's my hesitation for expanding, and that's my fear with not being able to provide this access to care.
We find it easier to find vets willing to do the wellness and expanded care side than we do the surgery,
Oh,
at
wow.
least in our location. I will say we pay per day for those days, and we pay pretty well for those days. We
Okay.
started with some grant funding, and so we were like, I want to get vets. I want them to be welcome. So we started at a pretty high day rate, and we've kept them on because of that. And you can't provide any of the services if you don't have the vet in the building. But
Right.
we, in the 15 plus vets we work with, only one is an employee. We contract with all of these different locations, all of these different vets, and we work with RU and RSVP, which are both basically like temp agencies for veterinarians. And finding surgeons through them, really, really hard. But finding vets that want to do an offsite vaccine event or do a basic care day, we've had a lot of success with that, but I do think that varies per community and what people are currently doing. But it hasn't been our roadblock.
Yeah, and it has, and Ray, we have reached out to UPenn, and I struggle. If you have a person there specifically for me to reach out to, I'd love to. I'm hoping, there is, and again, Daniel, this will make sense. Rowan University is building a vet school, that opens in 2025. That'll be about, maybe 20 minutes from us. So it'll be the first vet school in South Jersey. I've already, signed the contract of partnership of, I don't even know what we're partnering. I'm like, yes, we're partnering. So I'm hoping that helps. But yeah.
I also think it really helps that my Fort Worth team is incredibly strong in the vet tech side. They're incredibly strong. I have a vet tech that does the dental cleanings. The vet supervises, but they aren't doing that. The vet techs are doing almost all of the legwork. When we're doing off-site events, we're really utilizing the tech. So I have some vets that come, it depends on what they want. Like they can touch every animal, they can talk to every animal, they can vaccinate every animal. But once they come and do it with us, they see how well we can run it. And a lot of them are like, can I sit in the chair and just answer questions? And
Right.
so
Yeah.
they're seeing everybody, but when they're less hands-on, I feel like then they're more encouraged of being like, hey, this is easy money. I can go and hang out with my friends at Spay Neuter Network. We help a ton of animals. So the more you strengthen your team, I feel like the easier it is to get those people back in.
I think you're 100% right, because we have I have a dental suite just built, brand new equipment. It has been sitting there for 4 months because I have nobody to be able to do it. And we certainly have the need in the community, but my vet techs are not trained for that. I've been trying to hire a certified vet tech. But you know, we're trying to put that investment right now into the techs to build that up. But yeah, so I'm very hopeful that we can find a way to be able to expand this in the next couple years. Because everything that you listed is exactly, you know, it's exactly what we're doing and striving to do.
That's awesome. And if you ever want to send people down to, you know, Texas, happy to show people how we do dentals. Probably, I was gonna say, just come visit.
I was gonna say, I may take you up on that. My brother lives in oh, he's in Waco now, but yeah, he's next.
Texas is big.
Yeah, exactly.
Not that
He was in
far,
Dallas.
but it's not that close.
Mhm.
Yeah, but
And you-
happy to show people.
And you had mentioned Rue, using Rue as well. I wonder if do you know Hound.vet?
I do not.
I'm gonna put it in the chat. I wonder if that could be helpful too. They're cool people, and they do relief vets for hire, things like that. I don't know. Maybe that could be useful for you, Laura. I would check that out. Not 100% sure, but
Yeah.
you
And
maybe
I've been using, you know, so I've been contracting some of my wellness. My biggest concern, Jordan, for that, and forgive me if I'm hogging the conversation, is a overseeing vet. So if I'm having, because again, I can contract my relief vets to some degree, but somebody to just oversee it and make sure. And is that something, you know, how does that work with you with contracting vets?
My director of operations, all vets report to her. She is not a veterinarian.
Okay.
And I think we have a veterinary shortage. We do not need vets managing other vets. It's not something they go through in vet school. Let's let the vets specialize in the animal treatment and care side, and let people that are good at operations and scheduling do that piece.
Okay.
And if we are ever changing protocols, anything like that, I mean, vaccines are, let's face it, pretty easy. But if there's something related to changing a protocol or anything having to do with surgery, we involve all of the vets and we have a conversation, and then we come to a consensus.
Awesome.
And also, Holly put something very helpful in the chat about indie vets, which is big in the Philly area. That's absolutely correct. Thank you for that, Holly. Yeah, and Laura, I appreciate the involved questions. I think more people kind of need to be, you know, need to ask the right questions when they're struggling with things like you are, because I don't think it's just specific to that general area like the Voorhees area / Camden area. I think that that issue kind of replicates itself throughout the country too.
And it seems to me that this is the way, for example, there was somebody who was interested in one of our vet positions. She interviewed with us. We loved her. She was fantastic. I was willing to meet her salary. And then she ended up going to, and I was willing to do part-time, everything, ended up going to indie vets because of I needed just a little more of a consistent part-time commitment, where she's like, well, I can make my own schedule. And I feel like that's the trend now. And, you know, I'm willing to let them, but we have to have at least some consistency in the practice to be able to schedule. So, yeah.
Yeah, we have there are some clinics that are not as consistent as we'd like. We are working around all of the vets because they make everything happen for us. So
Mhm.
we've had
Yeah.
to be a lot more flexible than we probably would have been 5 years ago.
I wish my shelter recognized that because I'm the vet there and they're in the process of doing some really, really silly things and they just have no idea what's going to happen if I'm not there.
It's so critical to find a mid ground, right? We have to take care of ourselves and we have to make sure everyone is in here for the long haul. Like you guys are very, very valuable, but we need to make sure your quality of life is strong.
Mhm.
So I when I talk to people, I'm like, you want to come in and do surgery? You can be here from like 9 to 1.
Yeah, that's what mine is.
Make $1,000. Come on,
Mhm.
come on
Mhm.
down. Yep, it's crazy.
And Holly had put in the chat that she's in the process of getting her nonprofit started and looking for some guidance. And Ray, again, coming in with Maddie's Fund and PetSmart Charities, which have incubator grants. Awesome. Yes. And
Yes.
I would suggest PetSmart Charities. Maddie's Fund, I haven't heard of.
Oh, they're
Definitely-
fantastic.
Yeah.
They're fantastic. They fund all kinds of projects. They really want to help people get the work done, and their grants are pretty easy. If you have to do a grant report, it's a Zoom call with a group of people where you all get other ideas. Like it's really cool.
Okay,
I-
Jordan, I'm going to reach out to you separately because I have never been able to manage to figure out how to get a grant from Maddie's Fund.
I will help you.
You
I will
got it. So
help
I'll
you.
reach out to you
Yes.
separately.
I love it. Yeah. No, they're fantastic. And they
And
fund weird things. Like they'll fund tech stuff. They
Mhm.
will. They want to help anything that furthers. Right now, they're doing a lot of investment in the University of Tennessee and getting the paraprofessional positions going.
Mhm. That's awesome.
Smart Charities has a lot of access to care grants, and so does ASPCA. ASPCA is a little more rigid as far as reporting goes, but it's still worth it if you have the people that can do the investment. And you can always contract the person to write grants for you. Don't ever worry about like having a person on staff. You can always contract that job out.
Mhm.
Yeah. And Holly, feel free to reach out to me too. I wasn't there for the inception, but I've learned a lot in the nonprofit sphere. And Banfield does equipment grants
Yep.
and
Okay.
initiative grants. Lane is wonderful.
Okay.
So,
perfect.
so how with Banfield, their medical equipment is switching to Blue Pearl in August. So it's on their it's on their website. So yeah, so Banfield, yes, absolutely. They're great for medical equipment. That's how I have built my surgery suites and things like that. But just it's up, they are switching under Blue Pearl for their medical grant.
Yeah.
Okay.
Mhm.
Um,
And
yeah.
I do think in your community, obviously the family foundations are critical, like really finding out who do you tap into and let them know what you're trying to get done? Because almost all of our communities has some invested family foundation in animal welfare. So trying to figure out who that is, get them on your side to help, especially when we first got the mobile going, Saving Hope Foundation funded that.
Mhm.
And so really making sure that you've got one of those local groups, because they usually come through with some of the bigger money to help you launch.
Got it. Perfect. And yeah, I guess the big thing for us, I mean, in addition to the grants, I mean, that's all really great information. It's just like we're really at the stage of trying to even figure out like, okay, we have a mobile unit that we have access to that already has a surgical suite and stuff like that. So we're like, okay, great. That piece of the puzzle is solved, but it doesn't really have any cage space. So then we're trying to figure out, okay, like where are we going to recover animals? We do want to offer like sick appointments as well, because that seems to be a big need in this area, without having to go to, you know, an ER that's going to cost them thousands upon thousands. So yeah, I guess some of the logistics is where we also need help because we just don't know and nobody in the area offers that.
Yeah, and I will say, I know that we have fairly scattered portfolio at this point, but when we started, we focused on only spay and neuter. So I do think starting somewhere and getting that up and going is probably really smart so you don't stretch yourself too thin at the very beginning.
Yeah.
So many of the mobiles, ours is enormous. I mean, it's difficult to drive, but even only having a capacity to do 40 on it drives me crazy, because sometimes I have a vet on there that would do 50, but I can't fit 50 animals. Working in partnership with different shelters, different places. So if they have a community room or something like that, where you can have your volunteers help take the animals to recover, especially if you live somewhere where it's hot, you can't just recover them outside in pop-up crates right now, right? So finding some of those places, like different rec centers, that would maybe let you use an auxiliary room and build a group of volunteers that can help with doing that recovery. So basically using the mobile, but how can you expand your space to use some inside area, I think would be identify some of those collaborative partners to really get it kicked off.
Okay. Perfect.
Yeah.
Thank you.
Of course.
Let me put Jordan's LinkedIn and the Spay Neuter Network website in the chat, and then I'm putting my website and my LinkedIn in the chat. Let's stay connected. This was a good conversation.
Yeah.
I appreciate
Your
it.
kitty's incredible, by the way. Look at
His
that.
name's Chandler. He really he just loves joining in on these. He'll hear voices and come running, or he'll get he'll be restless and just come start cuddling. Anyway, thank you so much for joining, Jordan. I really appreciate it. Both you and Spay Neuter Network as a whole for being so generous with their time, and with everyone coming out. Jacob, Rachel, for having come out. I really appreciate it. Laura, let me write down that email.
And Holly, I just threw my email in there. If I can be helpful, I know you're on a call. If I can be helpful, reach out. Even if it's moral support.
Thank you, guys. I'm glad that we were able to stick around for this and trade some information. I hope that you guys can join any future conversations. I put the link to our past webinars, and any future webinars that will be coming up are going to be on that celeritasdigital.com/webinars page. Jordan, thank you again. It was so great to have you. And I hope everyone has a great rest of their week.
Thank you so much.
Bye, everybody. Good luck.
Bye.
And bye.